Hello and welcome to Dr. Ankur's Dental Lectures. I'm Dr. Ankur Sharma and today we are going to talk about the ABCDE of emergency. This is the first lecture in the clinical series of Case Vignette 1. Basically, it used to be called ABC of emergency management earlier, but now D and E have been added, so it is ABCDE of emergency management we are going to talk about in relation to the case of fractured mandible. Now, before we go to the steps, that is ABCD as such, there are some initial things that you must bear in your mind before treating an emergency patient. The first thing is to ensure your safety or personal safety. Use all barriers, all personal equipments like apron and gloves as appropriate. The second thing that you should do is look at the patient, how unwell he seems to be. Ask him, are you fine? That would be, of course, if he is conscious. Ask him, are you fine? How are you? Or are you all right? Right? And see what the response is. The feebler and milder the response, the more critical the patient is. So, these are the first steps that you should take. Well, if the patient is unconscious or he does not respond at all to what you ask, or he does not breathe properly, then a cardiopulmonary resuscitation should be started, right? And that should be, of course, according to resuscitation guidelines, for which I've got a link in my description here. So you can click it and go there and see what are the CPR rules and norms, right? Now, so these are the first steps that you should take before starting ABCDE in particular. So now we come to the first, that is A of ABCDE. A is about the airway. So we will talk about A, that is airway. Now, usually in case of fracture mandible, especially in case of bilateral parasymphyseal fracture, airway obstruction may be there because the tongue falls back. So in that case, what you should do is that lift the tongue and take it to the front. If it's possible, tie the tongue by passing the suture through it to the nearest. What we usually do is that if a patient is wearing something, we tie it to the first button of the shirt, or we should tie it to something which does not move, right? Other ways, the airway may be inspected. It should be seen that there are no pieces of bone or teeth which may obstruct the airway. If they are there, they should be picked with help of forceps, artery forceps, and a proper suction should be done in order to see and ensure that the airway is properly clear and patent. Sometimes there may be an airway obstruction. The patient may come with an airway obstruction, right? It usually causes the seesaw respirations of the chest, right? And forced breathing, that is, the accessory muscles of respiration may come to play during breathing. In case the airway obstruction has been for a long time, there may be a cyanosis. So what we should do is treat the airway obstruction first if we find an airway obstruction. Usually it is simple, as I said. It may require some maneuvers an airway suction, or sometimes insertion of oropharyngeal or nasopharyngeal airway. Now, in case there is a lot of obstruction, you may do a tracheal intubation, an endotracheal intubation. Sometimes giving oxygen may be necessary for airway. So, once you are sure that airway is patent, you should go ahead with the B, that is breathing. Now, how do we immediately assess breathing? We look, listen, and feel for general signs of respiratory distress. The first thing, we count the respiratory rate. A normal rate would range from about 14, sometimes it may be 12, sometimes it may be higher, up to 18 beats per minute. Right? If it is too high, the respiratory rate is too high, that means there's something wrong, there's some illness. And that patient's condition may become very bad suddenly. Now, sometimes the patient's breath sounds tell a lot of things, right? So we should listen to the patient's breath sound. We should check the position of the trachea. Now, deviation from one towards one side, it indicates mediastinal shift, like it may tell you that there's a pneumothorax, or there may be pleural fluid there. After we have seen and ensured that breathing is normal, we go ahead and see the circulation. Now, in order to judge the circulation, the first thing that we should see is the color of hands and fingers. What is their color? Are they normal colored? Are they blue? Are they pink? What are they? We should assess the temperature. Are the hands cold and clammy, or are they warm, or are they hot? We should assess that how the veins look. Are they underfilled or collapsed? Now, the most important thing we should look for is the patient's pulse rate. What is the type of pulse? Is the pulse rate normal? Is the pulse feeble? Is the pulse thready? What is the pulse like? Now, if we see anything wrong in these signs, we should get an emergency treatment reinstated for it. So that was the circulation. Sometimes there may be cardiac failure. We are not going to talk about that in this case vignette. So once we ensure that circulation is fine, we go to the D, that is disability. Now, is the patient conscious or unconscious? Right? Now, a patient may become unconscious because of hypoxia, which may be because of course, a problem in the airway, that is airway obstruction, or in a breathing problem. Or is there a cerebral hypoperfusion? That means is blood not properly reaching the brain, or is there any brain injury or head injury due to which the person is got unconscious? Now, at this time, we should examine the pupils about size, equality, and reaction to light. Right? The consciousness level may be assessed using the APVU method, that is alert. Is the patient alert? Does he respond to vocal stimulus? Does he respond to painful stimulus? Or is he unresponsive to all the stimuli? Or alternatively, we may use Glasgow Coma Scale. Now next, we sometimes may use the blood glucose or measure the blood glucose. And so we will see that if there's a disability, what might be the cause of disability. And finally, the E is exposure. The patient should be fully exposed. To treat the patient properly during emergency, it is important to fully expose the body. However, patient's dignity, it should be respected. And it should also be taken care that there is no heat loss. Heat loss should be minimized. So the temperature of the room around should be good. So those are ABCDE of emergency treatment or emergency management. I hope this lecture was useful to you and would be helpful to you when you are there in emergency room tackling those fractured mandibles. If you like this lecture, please subscribe to my channel and kindly visit my website www.dentallectures.net. Thank you for watching and bye-bye.